The FDA will decide in the coming weeks if it will approve a recommendation from a panel of experts to make Narcan available to the public without a prescription. The panel voted yesterday, making the recommendation. Now, the drug can counteract the effects of an opioid overdose in just a matter of minutes. And more than 100,000 people die every year from an overdose, for some perspective here. And according to the CDC, taking a closer look at local numbers, there were 775 overdose deaths here in Northeast Florida in 2021, the last time that they calculated these figures, and 8,200 across the state. In December alone, just a few months ago, Jacksonville Fire Rescue used more than 400 units of Narcan to reverse overdoses right here in our city. Susan Pittman, founder of Drug Free Duval, is joining us this morning. Good morning. Thanks for being with us.
Good morning, Jen. Thank you for having us.
Susan, why do you think making Narcan available to the public without a prescription is so important?
You know, it's crazy. We've been in this battle since 2013, and around 2015, we worked with a whole bunch of advocates from around the state to try to get more access, and there was a law passed, and then the next year a standing order that allowed you to get it, still a prescription, but through your local pharmacist who could actually issue that prescription. And so, you know, having it available without a prescription will just increase access. And as you can see, it's so needed. There have been 87 lives saved through a program that we've been doing, countless lives through what JFRD is doing, what our EDs are doing. And so if we can get Narcan in the hands of just regular lay people who are seeing and experiencing and knowing people that are overdosing, it's just going to save some lives.
You know, Susan, I want to also point out to our viewers, and I want to use this video that we have out of Tavares. It's of a police officer who came into contact with fentanyl during a traffic stop last year. She asked that this video be released to the public to show how dangerous the drug is. It somehow came in contact with her skin when she was interacting with that driver. And you can see her partners are now essentially saving her life by giving her Narcan. I think that what's important for our viewers to understand is even if they or someone they know is not taking illicit drugs, if you're in the wrong place at the wrong time, fentanyl can essentially still kill you.
Well, we know that fentanyl is prescribed by physicians through a patch, you know, to be absorbed in the skin. So certainly the skin, the largest organ in our body, is a great vehicle to get Narcan or to get fentanyl into your system or any drug into your system. So of course it makes total sense that if you're exposed to fentanyl in the skin, especially if you then just inadvertently rub your nose or touch your eye or any kind of place that there's an entry into your mucous membrane system, you can definitely overdose.
It only takes 7 or 8 grains, in fact, is what they have said, similar to salt or sand, to cause an overdose. So drug dealers, we know from law enforcement, are adding fentanyl to pills and other drugs to make it more addictive. Our viewers should know that we're not just talking about cocaine or heroin here. Teens, as you know, often buy these pills off social media because you've really tried to educate local teenagers about this risk.
We really have, and we have this terrific group of young people that have come together to coalesce around this, our Duval Collab group, and they just want to get the awareness out because fentanyl is being added to all kinds of things that they're pressed pills, and they look like a Xanax or an Adderall, things that teens regularly take prescribed by their physician. And so perhaps they've run out of their prescription or they have big tests coming up, and then they see the same looking pill on Snapchat advertised as the prescribed pill, and they get it, gets delivered directly to their home. And if it has, you know, you said 7 or 8 grains, that's conservative. Depending on the strength of the fentanyl, it can even be 3 or 4 grains of fentanyl in the pill, and it can actually kill them. The DEA says currently the counterfeit drug supply has 60% lethal doses of fentanyl in these counterfeit pills.
It's startling. You offer free Narcan training. Would you share with our viewers how they can learn this life-saving, technique?
Yes, and thank you so much for mentioning that because we are super excited about this being available. And Narcan is not hard to use at all, but there are a few little tricks that make it critical that you know these tricks. Because for one thing, I'll just give you one of the tricks. If you prime it, you use the dose. You do not prime Narcan. So you can take our free training. It's online. It's available twice a month standing. If the community needs it more, we'll offer it more. There's no charge, and currently it comes with a free Narcan kit, and we'd love for you to take it. All you have to do is go to drugfreeduval.org. The sign up is right on that main page.
And it is incredible. I took that class, as you know, and one of the things that startled me that I didn't realize is that, and why it's so important that if you do administer Narcan, that you need to still call 911 and get help for that person who's overdosed, because Narcan, you know, depending upon, you know, the condition of that person, you know, that person can still overdose again a few minutes later because Narcan eventually does wear off. So thank you, Susan, for the work that you do. And we want to remind our viewers at home that Teen Summit for your Duval CoLab group, which is just doing fantastic things with local teenagers, is actually having a Teen Summit coming up on March 26th, and we've posted information on newsforjax.com. March 26th from 1 until 4. You can look for more information on its Instagram page at Duval CoLab. Susan, thanks for your time.